Prostate cancer is the second most common cancer diagnosed among men in the United States. If diagnosed early, though, survival rates are high. Here to tell us more about detecting and treating prostate cancer is Dr. Matthew Ferroni with Mercy Urology Clinic. Thanks for being here. Now, where is prostate cancer located and which men are most at risk?
Yeah, so the prostate is a walnut-sized organ that sits right in front of the bladder. Its main goal, or its main role, is in fertility. As men get middle-aged, though, the prostate can be a source of problems, prostate cancer being one of them. About 1 in 8 men in their lifetime will be diagnosed with prostate cancer, so it is a serious medical problem. Risk factors for prostate cancer generally are family history of prostate cancer, African-American ancestry is another, but unlike things like lung cancer and smoking, there really aren't very closely tied risk factors beyond that, so it's important for all men to be screened.
Okay, that's the next question. How often is screenings? How often should screenings take place?
Yeah, so prostate cancer is screened with a simple blood test called a PSA, prostate-specific antigen. Most of the time, men get this done yearly by their primary care doctors during wellness visits. An elevated PSA number does not mean a man has prostate cancer. Lots of things can impact that number that are not related to cancer, but it's kind of a first step to figure out who's at risk of prostate cancer and who might need some more testing.
Okay, what are some of the signs or symptoms?
Yeah, so prostate cancer unfortunately doesn't really have many signs and symptoms until it's very advanced and potentially incurable. Most prostate cancer forms on the outside of the prostate as opposed to benign growth of the prostate, which tends to happen on the inside as men get older. So oftentimes we'll see men come into the clinic with concerns of urinary symptoms and worry about prostate cancer, but in general it's kind of an unrelated entity. And again, the reason it's so important to screen men, and we recommend screening generally to start about age 45. If men have other risk factors, 40 at the earliest, because if prostate cancer does become invasive and advanced and cause symptoms, oftentimes it's too late.
Okay, how is it treated?
Yeah, so a lot differently than it was 15 years ago or so, where all prostate cancer was treated invasively. Now, a lot of prostate cancers that we find are actually low-grade prostate cancers that just can be watched over time. Otherwise, surgery to remove the prostate or radiation treatments, depending on other factors like men's overall health and some of the certain side effects of each treatment.
Okay, great. Thank you so much for being here.
Yeah, my pleasure.
Stay
Thank you.
with TV9. We'll be right back.